Welcome back to Morning Break and this month's first Brain Matters segment with Dr. Randall Gates, board-certified chiropractic neurologist and chiropractic physician. So thank you so much for being here and for doing this topic, because it's one I specifically asked you for, because ever since I had my daughter over a year ago, I just feel like brain fog has been my constant companion. And I'm curious to know, is this something that's just temporary, or is this something that I might need to go and look at further? And of course, there are other people who are probably asking the same question. So let's start with the what is brain fog?
Brain fog is a hard to describe symptom. It can be described as mental fog. There can be elements of confusion, trouble focusing, feeling tired, lack of attention. So that's kind of what brain fog is. Around 28% of Americans can feel brain fog in any given year, but not that many are having brain fog on a daily basis. When people start to have it on a daily basis, we start to look to other disorders like autoimmune disorders.
And that's something that can be done with blood work or MRIs? Okay.
That's a blood work thing.
Okay.
So people can talk to their doctor about, hey, screen me for Hashimoto's thyroiditis. As we were saying beforehand, a lot of people think they've had their thyroid checked. In reality, when most people get their thyroid checked, they actually just have one blood marker for that. But there are other blood markers specific to the immune response that can say if you have Hashimoto's thyroiditis or not. Lupus can cause brain fog. Other autoimmune conditions can cause brain fog.
Okay, so if you get this blood work done, you get kind of a diagnosis. What next, you know?
And I'll also say within that, insulin resistance, prediabetes, diabetes can be really important.
Because I mean, obviously we've talked about the thyroid a lot. It affects pretty much everything in our body.
It does.
Yeah.
And as I use an analogy, I think in one of our recent broadcasts, I envision Hashimoto's thyroiditis as like you have a beehive in your gut. And when you eat the wrong foods or those bees get irritated, they will swarm and attack the thyroid. But also the bees inflame the brain as well.
Interesting.
But going on that, certainly disorders of blood sugar regulation cause brain fog. Also mast cell activation syndrome conditions cause brain fog. So those are high histamine conditions. All of those immunological and metabolic factors can result in these symptoms.
So the key being, if you think it might be something more than just a brain fog, is the consistency. If you're feeling like you're getting this all the time.
For sure.
Yeah,
for sure.
Okay. Later on, our next kind of step is like people start to think, oh, well, now I can't remember things, you know, and the first thought people often think is dementia, right? You know, like, oh my gosh, do I have early onset dementia? So is that a direct parallel, or is that something different and we need to differentiate between them?
We need to differentiate, and usually not. However, as we talked about recently, 42% of people over the age of 55 are on track to develop Alzheimer's disease.
Wow.
So a huge percentage of people, it's alarming. So now we have new tools available to really differentiate those who have brain fog versus is there a cognitive decline going on? And that's where imaging, like that is done at Advanced Imaging Reno, individuals can talk to their doctors and get referred for a brain scan at Advanced Imaging Reno with volumetrics. Where they can then talk to their doctor about how dense the memory is, because the memory area is the most vulnerable area of our brain. We should make 700 new brain cells there every day. However, if there's a neurodegenerative process going on, that neuronal production will not be happening at the same rate. So we can take that data along with cognitive testing, which most doctors can do in their office, and there are new blood tests available that can actually say, oh, it looks like there's an Alzheimer's process occurring or not, a vascular dementia process occurring or not, and then we can correlate that with genetics too.
Interesting.
So we really have great tools in 2025 now to differentiate who has brain fog or is there an Alzheimer's process going on.
And then you also had sent me a TBI report. Is that goes with the dementia?
Yeah, it's called the TBI report, but really that's a volumetric report, so it just tells the density of each area of the brain.
Okay, so can we pull that graphic up? So when you see this, I mean, the bright and colorful brain, that's showing you different levels of density.
Correct, and we want basically our brain to overall have good density, and when we particularly start to see a pattern of loss in one area or multiple areas, it can help us basically in the evaluation.
Yeah, so the good thing is that if you feel like you're having consistent brain fog and you have questions that it might be something sooner, there are options out there for you to go and get the blood work done, to go and get the test done, and give yourself kind of like that peace of mind that either it's not, and you know, there are other things that you can do to kind of treat the brain fog, which I guess would be what?
A lot of it is dietary.
Is it just dietary? Okay.
Well, and I know that's a funny one. But just diet is hugely important. I mean, diet is basically ruining our health in this country,
Right.
I would argue. So that's what I do at Gates Brain Health. I largely work with clients who have autoimmune conditions, mast cell activation syndrome, prediabetes, and we work with them dietarily. We run tons of blood tests. The phlebotomists at a lot of locations love us and kind of they're like, oh,
you got another one
from Gates Brain Health, because we really dig in and are very thorough looking into these metabolic factors that can cause someone to feel this way.
Interesting.
So it's so interesting. I mean, we do probably 10 to 20 times the amount of labs that most people have done.
Yeah, but I mean, what's really cool about today's technology is that you can get the answers.
The data's there.
You can get the answers that you have. Yes, it might take a little bit more blood drawn, so hopefully you're not too squeamish, just look away.
True.
But of course, if it is leading to something more serious, there are options as well for you. So Dr. Gates, thank you so much for being here.
Thanks,
we really
Katie.
appreciate it.
Appreciate
and thank you guys for watching. We'll be right back.